Initially, what will happen is you'll be told by your doctor that you have a mass in your kidney. And you may not know what that means, but what the doctor is saying is that you might have a cancer in your kidney. And immediately the thoughts go through your mind, what do I do? What's going to happen to me? What I recommend you first do is to consider calling us at the University of Michigan, because we have the experience and the judgment over years of practice to help you out with this difficult decision. Many years ago, say 2 decades ago, kidney cancer was primarily a surgical disease. By that I mean that the urologist cut the tumor out and that's all there was to do about it. We now have many other ways to treat kidney cancer and many other more thoughtful ways to diagnose and evaluate a patient with potential kidney cancer. Starting at the beginning, it all starts with the radiologist. Taking an x-ray, using the best x-ray machines available, using the best interpretation techniques, the best computer algorithms to figure out what that mass is without doing anything. Then maybe doing a biopsy. If the mass requires treatment, the radiologist might be involved, because here at the University of Michigan, our radiologists have great expertise in treating masses just with a small needle placed into the mass and destroying it from the inside out. If it's a little bit bigger than that, or maybe it's in a place where we can't do that, then the urologist might get involved surgically. But it won't be just open surgery. Most of the time now when we operate for kidney cancer, it's with what we call minimally invasive surgery, laparoscopic or robotic, something with small incisions that will get you on your feet faster and home in just a day or two. If things are more threatening, then the oncologist will become involved with giving chemotherapy or immunotherapy, perhaps even radiation therapy. And all of us work together. We have a weekly tumor board meeting. We're constantly in touch with each other, and we have care at many different sites. When you come to the University of Michigan, you'll be dealing with complete specialists, doctors, men and women who have focused their entire professional career on one very small area in medicine. But it's more than just the training that we received years ago. What's really special about University of Michigan is the ongoing training that's always here. The treatment of cancer has become increasingly dependent upon technology. And fortunately, at the University of Michigan, we have access to all the newest technology. More important than that, we know how to use those devices. We're the ones who are doing the research on figuring out how to best apply those to your cancer. And this is research that's not only impacting your care today, but we're also developing at the University of Michigan techniques for the completely non-invasive management of cancer, which we'll be treating you and your loved ones with in the next decade or two. Sometimes patients are a little leery of coming to a teaching institution because they are afraid that trainees involved in their care could be practicing on them. Let me assure you that is far from the case here. In fact, your care is better at University of Michigan simply because we have trainees here, because we are taking the time to train the leaders of tomorrow. And we have to be at the absolute top of our game to help them learn how to do their job best too. So in fact, coming to a teaching institution like the University of Michigan is a great place to get your care.